Welcome, listeners, to another episode of The Healing Spectrum, where we dive into the heart of human connection and the evolving landscape of therapy. Today's episode is particularly exciting as we explore a field that's just starting to gain the attention it truly deserves: sex therapy. Joining me is Dr. Laura Winters, a licensed sex therapist who's been in the field for over a decade. Welcome, Dr. Winters.
Thank you for having me. I'm thrilled to be here to talk about such an important and often misunderstood subject.
Absolutely. So let's set the scene. Can you give our listeners a brief overview of what sex therapy is and how it has evolved?
Sure, sex therapy is a specialized area of therapy focused on helping individuals and couples navigate issues related to sexual health and intimacy. While it's a relatively young field compared to disciplines like psychology or medicine, it's rapidly evolving. Today, we focus on a broader understanding of sexual health, looking at relationships, individual histories, and even cultural backgrounds, instead of just what might be wrong in the bedroom.
That's an important distinction. You mentioned that modern sex therapy considers a variety of factors. Can you elaborate on what makes sex therapy effective?
Of course, one significant advancement in our understanding is the common factors approach. This concept explores what effective therapies have in common, rather than focusing on a single technique. For instance, factors like a client's social support, resilience, and even luck can significantly impact the therapy's outcome. There are four key components: extra-therapeutic factors, the therapeutic relationship, hope and expectancy, and the therapist's model and technique.
Let's break those down a bit. Starting with extra therapeutic factors. What do you mean by that?
These are the strengths and resources that clients bring into therapy. It includes their personal resilience, cultural values, and social support systems, all of which can either aid or hinder their journey toward change.
And how about the therapeutic relationship? Why is that so crucial?
In sex therapy, feeling safe, respected, and understood is paramount. Sharing personal and intimate details requires a tremendous amount of trust. If clients don't feel comfortable, it can derail the entire process.
Absolutely. And then there's hope and expectancy. How does that play a role?
When clients believe change is possible, they're much more engaged in treatment and notice progress more readily. However, fostering that hope can be a delicate balance, especially when they might have faced repeated disappointments.
Finally, the therapist's choice of model and techniques. What should audiences know about that?
Skilled therapists are adaptable. They recognize that each person or couple is unique, which means no single protocol fits everyone. They balance theory and practical techniques, tailoring approaches based on individual needs and experiences.
Great insights. As we look ahead, it seems like sex therapy is on the brink of a paradigm shift. Can you tell us what that means for the field?
Indeed, the field is moving towards integrated approaches, considering not just individual psychological factors, but also biological and relational dynamics. For instance, how mental health interacts with sexual dysfunction is becoming a big focus. We're also seeing more collaboration with medical professionals to create comprehensive care strategies.
That's an exciting development. What new tools or techniques are emerging in sex therapy?
Digital tools are becoming more prominent. Online resources and virtual sessions can extend access to those who may face barriers, like location or stigma. We're also seeing a push towards models that are inclusive and reflective of diverse populations, which is vital in addressing the unique experiences of different groups.
Interesting. Now let's transition to something you mentioned earlier, the experiences of a sex therapist. What are some of the challenges and rewards of this profession?
Well, it can be both demanding and highly rewarding. On the challenge side, many regions lack dedicated licensing for sex therapists. This can lead to varying levels of competency and confidence in practice. Additionally, stigmas around sexuality can make therapists hesitant to specialize in sexual issues.
That sounds like a significant hurdle. Are there any steps being taken to address this?
Yes, organizations are encouraging rigorous credentialing standards to ensure safety and competency. This includes training that spans areas like sexual medicine and relational dynamics. Also, mentoring new therapists can help sustain and grow the field.
And what keeps therapists motivated despite these challenges?
Many sex therapists find their work rewarding due to the deeply personal nature of the connections they foster. Witnessing clients embrace their sexuality and move towards sexual happiness can lead to profound transformations in their lives and relationships.
Indeed, it sounds intrinsic to the human experience. Now, before we dive deeper into specific sexual concerns, could you share a bit about how these concerns are generally treated in sex therapy?
Certainly, modern sex therapy often employs an amalgamation of techniques including cognitive behavioral tools, systemic thinking, where the focus is on the relationship dynamics, and sometimes medical or pharmacological support. Each concern is approached through a unique lens considering individual and relational factors.
Let's take a look at some specific concerns. For example, how is anorgasmia, the difficulty or inability to achieve orgasm, treated?
Anorgasmia treatment usually involves understanding both individual and relational components. Assessing what triggers the problem, how long it has been present, and the meaning it carries is pivotal. Treatment could include cognitive behavioral strategies, improving communication around sexual topics, and, when appropriate, involving partners in therapeutic activities.
And what about delayed ejaculation? It's often a sensitive subject, but quite prevalent. How do therapists approach it?
Delayed ejaculation can be multifaceted, touching on individual and relational dynamics. Treatment often encompasses cognitive behavioral techniques, efforts to reduce performance pressure during intimacy, and introducing structured sexual exercises that allow for pleasure without the focus on achieving orgasm.
Those exercises sound fascinating. Now, if we shift to inhibited arousal in women, how do therapists address that?
Inhibited arousal requires careful evaluation of relational dynamics, hormonal shifts, like those during menopause, and any psychological conditions. Treatment may include addressing hormonal issues, incorporating couples therapy focused on communication, and creating individualized programs for personal sexual growth.
And what about painful intercourse, commonly referred to as dyspareunia?
Dyspareunia is understood through various lenses: physiological, psychological, and relational. A thorough assessment helps differentiate medical concerns from anxiety or relational issues. Treatments often include reducing anxiety, educational interventions, and various therapeutic techniques that promote better communication between partners.
I see. And as we discuss male sexual health, what's the approach for common concerns like premature ejaculation and erectile dysfunction?
For premature ejaculation, treatment could involve behavioral techniques, medications like SSRIs to prolong the experience, and assessing any relational or psychological factors that contribute. For erectile dysfunction, interventions may consist of medical evaluations, medications, cognitive behavioral approaches, and relationship therapy that emphasizes intimacy beyond performance.
And let's not forget about sex addiction. How is that handled in therapy?
Sex addiction is conceptualized in stages of recovery. Initial focus is on establishing safety, then stability, and understanding personal patterns. Later stages emphasize emotional processing and improving relationship skills while addressing cultural and relational influences that may amplify addictive behaviors. Infidelity, which seriously impacts trust, is approached through deep emotional work and structures aimed at rebuilding relationships.
That's incredibly detailed and informative, Dr. Winters. As we begin to wrap up, can you provide some insights on the future of sex therapy and how it may continue to evolve?
Certainly. As society becomes more aware of the nuances of sexual health, we will likely see continued integration of different therapeutic modalities. This means evolving training programs to encompass a broader range of disciplines, ensuring that therapists are well-versed in both sexual wellness and relational dynamics. We can also expect more inclusive practices that cater to diverse populations, further ensuring that every person's unique experiences are validated and treated.
Thank you so much for sharing your expertise and insights today. It's clear that while the journey of healing in sex therapy can be intricate, it is also filled with hope, growth, and transformation.
Thank you for having me. It's been a pleasure to discuss such a vital topic.
And to our listeners, remember that whether you're navigating personal dilemmas or simply curious about the fascinating world of sex therapy, there's always support and methods to help you on your journey. Until next time.